Hello, everyone. Um, Today we are going over human factors in aviation. This is for CFI and CFI ACS. It's Task A. I'm not sure what it is in the private ACS, but I went in and looked at it. It was essentially exactly the same. So this could work for either check ride prep. But we're just going to go through. This should cover every ACS line item. So yeah, let's get into it. I'm going off of my lesson plans that I have prepped here. All this information is coming from the handbooks, so the PHAC, the private commercial ACS, and CFI ACS. And that's it. So all this information comes from the PHAC. Alright, so starting out, I'll just give like a vague definition of human factors. It's going to be different factors that affect safety of flight that are a direct result of you being a human. You can't ignore that. You have to address those issues, and as you go through and train, you'll realize that that human factors constantly comes up. It's on every single check ride. You just can't avoid the fact that you are human and you have limitations, and so you have to be aware of those and know how to manage those risks. So starting off, this is a pretty big talking point in the past few years. I know I've been talked about it on, I think, every single check ride, and that is hypoxia. Hypoxia is just in general is the inadequate supply of oxygen in the blood. So because of one reason or another, you don't have enough oxygen in the blood. There are a few different types. So you have hypoxia, which is going to be typically what we are concerned with when talking about hypoxia. Hypoxia is the lack of oxygen in the actual air. So this is going to be what we refer to when we are, talking about hypoxia due to flying too high. That's going to be hypoxia. So there's nothing really wrong with you or your system. It's that there's not enough actual oxygen molecules in the air. There are some different regulations concerning this, but we will go over that in systems operations and oxygen. There's a few oxygen requirements, but for today's purposes, we will just say that it is recommended by the FAA that you use it above 10,000 feet MSL during the day and 5,000 MSL at night. Why is it so much lower at night? Well, it's not that there's less oxygen at night. It's the same at all times. But your eyes, the rods in your eyes actually use a lot of oxygen. So during the day, you're only really using your cones in your eyes. Cones are used in bright light. Your rods are used in no light. So they use a lot of oxygen, so they're a lot more susceptible to hypoxic effects. Next, we have hypemic. We have hypemic hypoxia. So the blood cannot carry the oxygen. So there's enough oxygen, but your blood cells cannot carry it up to your brain and whatnot. A prime example of this is going to be carbon monoxide poisoning, which we're actually going to talk about more later. But yeah, the carbon monoxide binds to your blood cells and oxygen can't attach itself to it. So your blood cells just physically cannot carry the oxygen. Next we have histotoxic, which is hypoxia induced by alcohol or drugs. Again, the cells just can't use the oxygen molecules because they are being, it's inhibited by alcohol or drugs. And then lastly we have stagnant hypoxia, which is hypoxia due to G-forces. So, when you are getting pushed down in your seat, the gravity is pushing your blood down to your legs if you're in a seated position. So your body, or your heart, is not physically strong enough to pump that blood up to your brain against those G-forces. Now, in general aviation, flying at 172, it's not really a concern. But it is a form of hypoxia. So, a few things. What is the cause of hypoxia? Well, we kind of already outlined that. It is the lack of oxygen in the blood. Most commonly, for aviation purposes, it's going to be flying at a high altitude. Next, we have symptoms. There are a multitude of symptoms that you will experience. Feelings of euphoria, so just feeling really happy, like everything is great. You would get maybe some purple fingernails if you're flying with someone else and they have blue or purple around their lips. Dizziness, and then a big one is a feeling of drunkenness. When people drink, what is causing that effect is it's essentially histotoxic hypoxia. It's a lack of oxygen to the brain. So you're going to have very similar effects to being drunk. And then treatment is to get more oxygen. However you go about doing that, but you have to get more oxygen in your system. So for, most of the time when we're experiencing hypoxia, we're flying too high, the easiest thing to do would be to descend, which sounds a lot easier than it is, because you get up there and you're just not thinking straight. The controller, I've seen videos of controllers, like calling out pilots saying, hey, you need to descend, you're not acting right. And because he's inebriated, essentially, he's feeling the effects of hypoxia. He's like, no, I'm good, I'm all right, I'm just putting along. So it can be a lot harder than it sounds just to descend, but that is what you need to do in that scenario. Or if you have supplemental oxygen, to use your supplemental oxygen. Okay, So that's all I got for hypoxia. Moving on next to hyperventilation. So contrary to popular belief, hyperventilation is not it is not the lack of oxygen. It is actually the lack of CO2 and there being too much oxygen in your lungs. Because you think about it, you're breathing in plenty of oxygen, but you're just constantly expelling that super quick. So what CO2 you do have, or carbon dioxide you do have in your lungs, you're immediately pushing it out, and so your system is imbalanced. Well, we'll start with the cause. Typically, it's going to be stress. And then if you are on supplemental oxygen, if you're breathing in pure oxygen, that can also cause that. Some symptoms, we got lightheadedness, dizziness, passing out. You can absolutely pass out from that. Visual impairments, your vision may start to come in. But yeah, so those are your symptoms, and then treatment is just to slow your breathing. So you've all seen someone with a bag, breathing in a bag, that works. Singing, or even just like talking to someone else. At the end of the day, if you do have a passenger who's hyperventilating and they do pass out, it's okay. All that's going to happen is they're going to pass out, their brain is automatically just going to take over their breathing, and it's going to automatically slow their breathing, and eventually they're going to wake up. If that's what's going on, if those are like underlying things, then you can't really guarantee that. But typically, it's not a big deal, it's going to be okay. So yeah, that is hyperventilation. Now we have middle ear and sinus problems. So this is one that people often overlook until they get bit by it for the first time. The biggest concern with middle ear and sinus issues is pressure. So everyone knows what it feels like to get a cold. You're all stopped up, can't breathe. Sometimes your hearing may even go out a little bit. Well, what's causing that is blockages, okay, in your sinus cavity and your ears. So your eardrums are actually, they are swollen, I guess, inflamed. So your hearing is starting to go out. If you go get in an airplane and you start climbing, the pressure gets, stronger and stronger. The density decreases, so your sinus cavities want to expand, and that causes pain. For your ears, if your eardrums are inflamed and swollen, there's actually this is your eardrum, this is your ear canal. There's a little tube down here that connects both sides that equalizes the pressure. But when your eardrum gets swollen, that tube will get blocked. And then this here can't equalize with outside. So as you climb, this is going to want to react to the pressure difference, and it's going to cause pain. And when I say pain, it hurts. It really hurts. It is not a pleasant experience. And you definitely don't want to be flying solo having to go through that. So if you are experiencing a cold, if you're just stopped up in general, you're not allowed to fly on allergy medication or anything like that. So the best option is just to not try it. Don't go fly. If you do find yourself in that situation, the best thing you can do is slow descents to try to slowly equalize the pressure. You can do the trick where you plug your nose and blow to try to pop your eardrums and maybe open up that little tube. But just a slow descent, just trying to equalize until you can get down to airport elevation and land. Alright. Now we have spatial disorientation. So this one is kind of a hard one for me. It doesn't really click for some reason, but I'm going to try my best to explain it as accurately as I can. So spatial disorientation is the loss of an accurate perception of your orientation, of your body's orientation in space, due to conflicting information sent from your orientation systems. Well, what do I mean by orientation systems? So there's three that all work in conjunction to help determine where your body is in space. So the first one is the vestibular, and then there's the somatosensory. Oh, I can't ever spell this one. Somatosensory. And then visual. So these three systems all work in conjunction to accomplish orientation. The vestibular, that you've probably heard of before, is the fluid in your inner ears that moves back and forth and gives you sensations of acceleration. So whenever you spin in a chair and you get dizzy, that's your vestibular system acting up. Somatosensory is your nerves and your skin and your joints and even your hearing that reacts to gravity. It feels gravity. So if you're in 1.5, 2 Gs, that's what is sensing that, is this system. And then visual, self-explanatory, it is your eyesight. This is the biggest one that helps accomplish orientation or accurate orientation because you have the reference, the visual reference that you can base off of. An example of that would be, it's a lot easier to tell which way you're turning when you can see the horizon right out in front of you. So if the horizon is either like this or if it's like that, you get what I'm saying, rather than it would be if you close your eyes and try to determine which way you're turning. If you've ever done unusual attitudes, you know what I'm talking about. So those are the three systems. The conflicting information from those systems can cause your illusions, your spatial illusions. So I'll go ahead and preface this. There's two types of illusions. There's spatial and there's visual. A lot of times people use a very common acronym called ICE flags. I'm not really a fan of ICE flags because it doesn't split these two up, and it also leaves out some pretty important ones. So as I'm going through, you'll see the elements of ICE flags, and when I say that, it's like the acronym. But I'm going to split them up into spatial and visual. And I'll have a couple more under visual as well. So the I in ICE flags is inversion, which is a spatial illusion. Inversion essentially is when you abruptly level off from a climb, you'll get the feeling, your vestibular system will tell you that you are falling backwards. And that's because of the fluid in your inner ear. Next, we have Coriolis. This one is if you were in a turn and you hold that turn for a longer amount of time. We'll say 720 degree turn, and you make a sudden head movement, you will become super disorientated and just like essentially just all out of whack. Essentially like you're dizzy. You'll get dizzy. That is because when you're in the turn and the fluid senses that turn initially, but eventually it relaxes, and so that turn becomes normal. And then you flip your head around, and then the acceleration of the turn messes with the physical movement, and it throws you all out of whack. So this would be something doing like steep turn. If you were doing steep turns, and there's a bird coming right by you, and you watch that bird go by, and you get all messed up. Okay, next we have elevator. The elevator illusion is with brief vertical accelerations, so like this, will cause the feeling of climbing or descending, even if you are staying level. And that's all we have for that. Now we have our first visual, which is false horizon. False horizon is it's a visual illusion that mistakes a line of lights or a line of clouds, anything that essentially makes a line that is visual, is mistaking that for the horizon. So if you're flying along and this is your cockpit here, you're flying along and there's a cloud layer that's kind of going this way. If you're experiencing this illusion, you're going to turn this way because you think that that's the horizon. So say there's a bunch of a lot more clouds in our ear, or like fog or haze, whatever it is. So you're going to turn your airplane to align with this horizon. So that is the false horizon. Like I said, it could be lights, could be street lights, anything that can simulate a horizon. Okay, now we have the leans. The leans is similar concept as Coriolis. Whenever you are in a steady turn for a long period of time, the fluid in your ears senses the turn and then it relaxes. And then whenever you turn out of that to go level, your inner ear is reacting the other way. So as you're leveling, it's going to feel like that you are turning right. And it's going to feel like you're constantly turning right. Okay. Now we have autokinesis. Autokinesis is when you are staring at a light at night, whether it be like a star or maybe there's a tower or something with a light on it. But you're staring at a light. If you stare at it for long enough, it's going to seem like it's rapidly moving around, when in reality it's not. Graveyard spiral, which is spatial. So graveyard spiral happens when you're in a turn and it's a slow turn. Your airplane is just gently going into a turn. So your vestibular system is not recognizing that it's turning because it's so slow and so gentle. And you're not paying attention to your instruments. And so it's turning, and you kind of look down and you glance, you're like, oh shoot, I'm losing altitude. So you pull up, you pitch up. Well, you're in a turn, but you don't know that you're in a turn. So you're going and you pitch up, and you see that you're still losing altitude. So you pitch up more, and you pitch up more, and you pitch up more, and eventually you're going to spiral down and crash. That is graveyard spiral. And then lastly, we have somotographic illusion, which is acceleration causing a feeling of pitching up. So this is a big one on takeoff because you are accelerating, so you may get that feeling that you are pitching up when in reality you're not. To continue on our visual illusions, sorry, I forgot to mark these off. We have a few more that Ice Flags doesn't cover. We have featureless terrain, which involves any terrain, so the ground, that doesn't have like distinctive features that you can gauge depth off of. So still water, really like a fresh layer of snow, things like that. Even the black hole effect at night when you're coming in and there's no lights below you as you're landing, so you can't gauge depth. That falls into this category. It essentially, like I said, you can't really gauge how high off the ground you are. So it will cause you to come in really low on approach. Okay, and then we have runway width. So runway width is pretty much all, what's the word I'm looking for? Subjective, I guess. So it depends on what you're used to. So if you do your training at a small municipal airport, we'll say 50-foot wide runway, something like that. When landing So I'm going to call this your runway. This is your airplane. When you're landing, you get used to a certain sight picture. So you know that you're about to touch the ground when, and I'm just making this up, when the outside of the runway reaches the outside of your windscreen. Something. It's not even necessarily a conscious thing. It's just like a subconscious feeling. So you build that sight picture constantly as you're practicing here. Okay. Well, what happens when you go from this small runway to a big runway, a much wider runway? Let's say you go to a Charlie or something. Your sight picture, that is the runway at the edges of your windscreen, happens a lot quicker because the runway's bigger. So instead of seeing that sight picture when you're, 10 feet off the runway, you're now seeing that sight picture at 50 feet. And so you're going to want to come in a lot higher than you should be. And it's vice versa for the other way around. If you're used to flying it on a wide runway and you go to a small runway, you're going to be a lot lower. There's a chance that you just smack it into the ground. Similarly, we have terrain / runways. So this one's pretty interesting too. So on a level runway, you're coming in at about 3-degree glide slope. Okay. And like I said, you build up that sight picture that you see every time. So if we take the runway and we make it upsloping, as a pilot, you're going to want to have that same sight picture. So if this is where you're at on a level, this is where you're going to want to be when it's upsloping, because you want to see that same sight picture. When in reality, you should be up here because you're super close to the ground down here. You see what I'm saying? So as you come in, if the runway is upsloping, it's going to make you come in lower than usual. So if you know that you have an upsloping runway and you're not used to that landing at that airport, you want to purposefully come in higher on the glide path than you think you need to be to make sure that you have an appropriate angle. Same thing for downsloping runways. So if this is your normal approach, if it's downsloping, you're going to want to come in really high. That's a really steep attacking. So you got to come in a little lower than you think you need to be in order to make it work. The main takeaway of illusions is trust your instruments. You have to trust your instruments. And this will be really nailed into you during instrument, but for private, you're really focusing on visual flight. That is the main focus. There's a new push with integrated flight instruction to learn both visually and by reference to your instruments, which is a great thing, I think. But you have to, know how to use your instruments, know how to read them properly and efficiently, but also to trust them. Because at the end of the day, these are going to be, I'd say 95% of the time, they're going to be a lot more reliable than this. This is subject to a lot of flaws. These are mechanical things that, yes, they fail, but in a life or death scenario where you are super disorientated, that's going to be your best bet. So yeah, trust your instruments, use them. much as you can. Alright. So that is, that covered spatial disorientation and then visual and optical illusions. Now, next up, motion sickness. Motion sickness is caused by the same thing that causes spatial disorientation. It is it is information that does not match going into the brain. How exactly that correlates to you becoming nauseous, I'm going to be honest, I don't really know. You'd have to ask a doctor about that. But it can be intensified by stress and anxiety, the same as like hyperventilation and all that stuff. But the root cause of it is a mismatch of what you're feeling and what you're seeing. It's the same thing as car sickness. When you're in the back seat and you're looking down at your phone and your body is feeling all these movements, but your eyes aren't seeing that because you're not looking outside, you're seeing a still object. So that's where the conflicting information comes from, and then you start to feel sick, which is not good. The way to recover from this is to land as soon as possible. While you're still in the air, try to avoid turbulence and like sharp turns and stuff. Try to keep it real smooth. Looking outside, picking a point outside and looking at that can help as well. And then making sure that you always have a barf bag, because you never know, you'll need it. Especially with people when it's their first time flying or an early on flight, make sure to have a barf bag. Okay, we mentioned this earlier, but carbon monoxide poisoning. So I think pretty much everyone is aware or has heard of carbon monoxide poisoning and what the hazards are with it. All of our houses, or most of our houses, have carbon monoxide detectors. But just kind of to rehash, carbon monoxide is invisible, can't see it, you can't smell it. So it's really hard to detect without an actual detector. It's very dangerous. It causes very similar effects to hypoxia, because in a sense it is hypoxia. It is hypemic hypoxia, which makes sense. That's the danger of carbon monoxide poisoning, is that it's binding to your blood cells where you can't bring oxygen to your brain. So you're going to have similar symptoms. So just to go over it again: dizziness, lightheadedness, sense of euphoria, purple or blue fingernails and or lips. If you have a feeling that you're experiencing that, or if your detector in your airplane is saying that there's carbon monoxide there, you have to get in fresh air. That is number one, is get in fresh air. Number two would be to close the heater, in case the monoxide's coming from your exhaust, a crack in the exhaust manifold or whatever it is. But number one, you have to get fresh air. So open up windows. If you don't have windows, open up the door. It's not going to hurt the airplane as long as you're, not at your never exceed speed or your maximum structural cruising speed. you can open the doors. Realistically, it's not recommended by the manufacturer, but if you're about to succumb to carbon monoxide poisoning, I think it's going to be okay. So do what you have to do to get fresh air. Open up the outside air vents. Get some oxygen in you. Yeah. So I wanted to show you this, just in case you've never seen it, but this is what, that is what your carbon monoxide detector looks like in your airplane. When it senses carbon dioxide, the middle of this, carbon monoxide, the middle of this will become darker. I've never seen it happen. It would probably be a good thing for me to look up a video of it. I recommend you do that too, just to know exactly what you're looking for. Alright, that is carbon monoxide. Kind of like I said too, the most common way to get that is from your exhaust, one way or another. Alright, next we have fatigue and stress. So, each one of these has a chronic version and an acute version. What is the difference between that? Chronic is lasting, so it is a result of a buildup of XYZ, which acute is just a temporary feeling of that, whatever you're feeling, either fatigue or stress. So for fatigue, let's start with acute fatigue. So this is going to be a feeling of tiredness after a long day's work. You are tired, you're tired for the moment, but as soon as you rest and you get sleep, that tiredness goes away. On the other hand, chronic fatigue is when you have these periods of tiredness and you're not getting adequate rest, so you wake up from your rest tired, and then you work all day and you're even more tired, and then you don't get enough rest that night, and you wake up and you're just falling behind and behind and behind again each night. That is chronic fatigue. The way to reduce that is to get plenty of sleep, which is the obvious thing to do, to rest, but also to eat if you haven't eaten, drink plenty of water, just maintain a healthy lifestyle, exercise, all that good stuff. That's part of the reason why airline pilots have required rest times in between flights. The FAA says that heavy fatigue, so extreme tiredness, has the same cognitive effects as 3 alcoholic drinks. So if you're flying and you're dead tired, and the only reason you're flying is because you want to go home, and you know you shouldn't be flying, but you are, that is, you're essentially, you have the same cognitive function as a person who just had 3 shots. It's just kind of crazy to think about. Stress, same thing, you have acute and chronic. Acute stress is your fight, flight, or freeze reaction. So that's going to be stress caused by something in the moment, whether it's like a stressful flight, or maybe you're on a check ride, and you're going to have that initial reaction, your fight, flight, or freeze. However, that stress goes away when the underlying factor is resolved. So once the flight is over, that stress is gone. That is acute stress. Chronic stress is stressors in your life that are caused by more so going to be like large life issues. So, I mean, I'm talking like financial issues, relationship issues. Maybe you have, something going on with your job. Um, a family member passing away, something like that, to where you can't really eliminate the underlying issue like in that moment, and it's something that lingers and causes stress day after day. The part to consider for stress, acute stress to a point can improve performance. After that point, performance drops off. Once performance drops off, if you notice as an instructor or even as the student, if you've passed that threshold, the flight should be over, because at that point you're not going to really learn anything, you're just wasting time. However, but during that initial rise in performance due to stress, it's very beneficial. Chronic stress, there's not really any advantages. You're not going to gain performance. It actually just decreases performance overall. Realistically, the pilot should, ground themselves until the underlying issue is resolved and that stressor is eliminated. However, in real life scenarios, is that going to happen? No, probably not, especially if it's like a financial thing and you fly for work, you're not going to do that. So just really evaluate what you think you should do and what is the safest thing to do. And I would recommend that you do ground yourself if you're in that situation. Alright, so that is stress, or fatigue and stress. Alright, now we have dehydration, which is pretty simple. I'm not even going to write it down. It's the lack of water in the body, like an extreme lack of water. If you're feeling dehydrated, you're feeling the effects of dehydration, drink water. That's the only way you can resolve that, is to drink water. Headache, fatigue, cramps, sleepiness, dizziness. We've all been dehydrated. When you're dehydrated, your body tells you that you need water, so just drink water. And in the summer months, drink water days ahead. Be on top of your water intake so you don't get dehydrated. Okay, and then we have the bends. What are the bends? The bends is an excess of nitrogen in the blood. This is caused by going to altitudes, negative altitudes below sea level, aka scuba diving is a really big one, where the pressure at that level essentially allows your body to increase the amount of nitrogen in the blood. There's a whole science behind it, like the molecules expand and all this stuff, but realistically all you have to know is there's more nitrogen in the blood down. Okay, so when you come up to surface level, if you fly very shortly after you were down here, that is a huge change in pressure and atmospheric pressure. So the nitrogen in your blood causes the nitrogen to form bubbles in your bloodstream and can be fatal. Yeah, I think I explained that correctly. With this, there are some limitations put in place by the FAA for scuba diving in general. So, if you go scuba diving, which this is a very rare scenario, but you kind of just have to know it. If you have a passenger that went scuba diving, or if you yourself went scuba diving, and you went down, and you went and you looked at all the fish, and you went so deep that you have to make a controlled stop on the way up to wait a second to equalize pressure before you continue on, you have to wait 24 hours before flying, period. If you went scuba diving and you didn't have to make that controlled stop, so you didn't go very deep, you just went straight up to the surface after you're done, you can fly in 12 hours if you are staying under 8,000 MSL. If you're planning on flying over 8,000 MSL, then you have to wait 24 hours. Realistically, just don't scuba dive the day before you're going to fly. That would be the smartest thing to do and the easiest thing. But those are the regulations of it. Next, drugs and alcohol. The rules: you cannot fly an aircraft or act as a crew member if you are under the effects of drugs and alcohol. That includes, being drunk, that includes being buzzed, that includes being hungover, which is you're still under the effects of alcohol if you're hungover. And then you have to have less than a 0.04 blood alcohol level, and you cannot have had a drink within 8 hours. However, I would highly recommend that if you are a drinker, you would expand those, rules. I would go as far to say 24 hours, bottle to throttle, not have a drink within 24 hours of flying a plane. And then if you have a blood alcohol level at all, you should be fine. Same goes for drugs. You cannot operate on drugs, which is probably a good thing. If you notice that a student or a flight instructor is under the influence of alcohol, it is your job to say something. It's not my job, it's out of my pay grade. That is, because that is in your bubble, you have a ethical responsibility to say something. Now, I'm not necessarily saying, if they come to the FBO and they're getting ready for a flight, you should call the police. Now, maybe start out by just saying, hey, I think you should go home. And then if they keep escalating and they don't go home, then you can contact the authorities. Okay, now, this is kind of where we make a transition from physical human factors to mental and psychological human factors. So the first one is aeronautical decision making and single pilot resource management. Aeronautical decision making is a structured framework that helps pilots make the right decision when faced with a task. There are a lot of methods to do this, but the main two concepts, I'll give it two, of aeronautical decision making are aviate, navigate, communicate, which you'll hear that hundreds of times in your career. Fly the airplane first, then navigate both where you're going, but also navigating checklists, all that stuff, and then communicate. If you have an engine failure, your first tendency should not be to tell ATC. It should be to fly the airplane. Once you know that you're flying, you've established best glide, then you navigate the problem, and then you communicate. And then secondly, we have the DECIDE model, which is an acronym, which is detect, evaluate, choose, identify, do, and sorry, I messed that up. That's embarrassing. Detect, estimate, choose, identify, do, evaluate. So, detect, you detect the problem. Estimate, you estimate the need for a reaction. Choose, you choose what you're going to do. You choose your reaction. Identify the steps of that action. Do the steps, and then evaluate to see if it warrants further action. If it does warrant further action, start over. However, what a lot of new pilots get confused on is you're not running through this. You're not, like, if you're faced with a problem, you're not saying, okay, I've detected the problem, now let's estimate. No, this is a subconscious process of dealing with things. But going back, this is the main concept, I would say, of aeronautical decision. There are a bunch of other checklists that we also use. So we have PAVE, which is pilot, airplane, environment, and external factors, or external pressures, some say. The PAVE checklist is used to categorize risks. So, what are the risks associated with you as the pilot, with the airplane, with the environment, and then with the external factors? There are a lot of sub-acronyms to further help identify those risks. So for pilot, you have I'm safe. Airplane, you have GARO, or ARROW, and aviates, so on and so forth. But the gist of it is it helps you categorize your risks and really helps to identify risks associated with the flight today by going through each category and really thinking about it. Then after that we have the CARE checklist, which helps determine the level of risk. So consequences, alternatives, reality, and external pressures. What are the consequences of the risk? What are some alternatives we could face? What are some alternatives we could choose? What's the reality of the situation? And then what are some external pressures that may cause me to make one decision or another? And then lastly, we have the TEAM checklist, which helps deal with risk. It helps kind of solve the risk, I suppose. So we have transfer, eliminate, accept, and mitigate. So transfer, is there anyone you could ask to help solve the problem? Eliminate, is there any way that we can just flat out eliminate the risk and just be done with it completely? Accept, can we accept the risk? Do the benefits outweigh the cost of this particular decision? And then mitigate, is there something that we can do to help minimize the chance that the risk causes consequences, essentially? And that's all I have for ADM. Single pilot resource management is the same concept. This really covers both, but single pilot is more so focused on flying as a single pilot. It is a offshoot of crew resource management. It's kind of the same thing, but it just focuses more on proper decision making because you're by yourself, as well as using all the resources that you have, knowing what you have, and of course the task prioritization that's involved with that. So if you're flying by yourself, aviate, navigate, communicate is a lot bigger deal than if you're flying with two people, to where, you know, one person, you have a pilot flying and a pilot monitoring, where one person's just running through checklists while all the other person has to do is fly the airplane, as opposed to just having one pilot who has to do both. So just being aware of that is a big one. Also, what I did mention is there's the 5 Ps and the 3 Ps. The 5P checklist is pilot, plane, passengers, programming, and plan. That is to help find risks on the ground. It's similar to PAVE. And then you have the 3 Ps, which is perceive, process, and perform, which is similar to the care and team checklist, which helps helps manage risks and solve problems like in the air. All right, distractions. I might write this one down. Well, okay, so distractions. Loss of situational awareness, and disorientation. So we already kind of talked about disorientation, so we can not skip over that, but we don't need to talk about it as much. Distractions, which a lot of times lead to loss of situational awareness, are a pretty crucial risk that we need to minimize. There are a few methods that we use and should emphasize as flight instructors that help maintain situational awareness and really build up a solid foundation of awareness, I suppose. Basically just kind of being a steel trap, not letting anything, mess with the task at hand. So a door popping open in flight is one of the most dangerous situations for a private pilot. Statistically, it causes a lot of crashes. However, I've seen people land an airplane using the doors as rudders to turn left and right. You can fly with a door open. The only reason why it is so dangerous is because they get distracted by that and it engulfs their attention and they lose situational awareness of everything else going on. And they lose control of the airplane and they crash and they die. You have to maintain situational awareness. You have to know what's going on at all times. You cannot ignore what's happening because you're flying through the air. I don't know how much simpler to put that. One thing you can do is use positive exchange of controls. So this is my airplane, your airplane, my airplane, or my controls, your controls, my controls. So as an instructor, we start up the airplane. We'll say I started the airplane, so I'm holding brakes. We run through the checklist, we're ready to start moving. And I'm going to say, okay, I'm going to check my brakes, my controls. The student would state your controls, and then I would say my controls. So that way, each one of us has verbally recognized that we know who has control of the aircraft. You want to do this anytime you switch from one person flying to another. It's always three parts to it. A three-way exchange. Next, we have sterile cockpit. This is eliminating conversation not related to the task at hand during high workload areas of flight, which essentially includes everything other than crews. In a training situation though, realistically the only time that you would really have to talk about something that's not aviation related would be during taxi, if you've already taught the student how to taxi. So eliminating that, but everywhere else, at least with teaching a private student, the instructor should be teaching the whole time. You're not going to have time for a casual conversation in between steep turns and power off stalls. So theoretically it shouldn't be that big of an issue. It may come more into play during cross countries and stuff like that. But at that point you're in cruise, or you don't want to talk until you're in cruise to maintain your sterile cockpit. And then lastly, use of distractions in training. The instructor should the instructor should purposefully cause distractions during initial training. It helps train the muscle of, recognizing the distraction and then deciding if it warrants further attention. A lot of times it's going to be the old pencil draw or I don't know, maybe like digging in your bag or something of some sort that will cause the student to look away for a moment, and then they should return back and focus on the task. You can't ever eliminate the initial look. That's just human nature. But what you can train is, okay, that doesn't matter, I'm back here. Okay. Confirmation bias and expectation bias. Confirmation bias is tell you what, before I say something wrong. I don't have it here. To the best that I can remember, confirmation bias is essentially just hearing what you want to hear. So if you are holding short and the controller says, better scenario, you're flying downwind and the controller says, Ostate 12, follow the blue Cessna, number 2, clear to land. And you're, as he's saying that, you're looking outside and you see traffic and you see a red airplane. And you see that plane and you know that the instructor is about to tell you to follow in an airplane. And you're looking at that red airplane and the controller says follow the blue airplane. Well, because you were expecting him to say red airplane, that's what you heard him say. That would be confirmation bias. Expectation bias is the common example of, you get a taxi route every single day. You get the same route to, the same runway. And then one day there's repairs on the taxiway and the controller gives you, different taxi instructions. And you read back those taxi instructions and then you just follow the same route you've always done anyways. Or it could be that, he reads you off the change taxi instructions and you just repeat back what you've always done. That would be expectation bias. Sorry, I know that was not a good explanation, but I low-key kind of forgot the difference between the two. Okay. Next, 5 hazardous attitudes. You will never escape this. This will always be a thing in aviation. once you learn it the first time, don't forget it, because you're going to need to know it for every check ride. 5 hazardous attitudes. So these are attitudes that if you, well, these are attitudes that people have commonly that cause safety risks based on, the thoughts and the actions that these attitudes allow or promote. So there are 5. So there is an acronym, RAIN: resignation, anti-authority, impulsivity, invulnerability, and macho. So with these, there's a phrase for each of them that helps you recognize helps you recognize that this is what that attitude is. It'll make more sense if I get through it. So, resignation, if you are saying to yourself in your head, what's the use? So you are, you have a emergency and you're dealing with that emergency and you're just so overwhelmed and it just seems like anything you do, you're just doing it wrong and you keep having to running through checklist, and by the end of it, or halfway through, you just say, you know what, what's the use, I'm done. That's a hazardous attitude of resignation. The fix for this, or the antidote, would be, I'm not useless, I can make a difference. So that's what you'd want to tell yourself if you are experiencing resignation. Anti-authority. The phrase that you would hear for this would be, don't tell me what to do. So this could be a act of rebellion, I guess, against like a manufacturer, like what the POH says, or maybe what the controller says, or even what like your flight school dispatch or your flight instructor. Anytime that you are just like, you know what, don't tell me what to do, I know, like I don't need that. That is anti-authority. The antidote for anti-authority would be follow the rules, they're usually right. Which is true. They are typically correct. A lot of the rules in aviation, it's commonly said that they are written in blood because a lot of the rules and regulations are there as a result of an accident where people died. So it's important to follow the rules. Impulsivity. The phrase for that would be do it now. If you are, trying to do things quickly. I have a whole rant on this, on taking your time. I think it's one of the dumbest things you can do in aviation is to go fast. But I won't do that. I'm already an hour and 20 in. But the antidote for this would be take your time. Impulsivity, I just did that one. Invulnerability. This would be, it won't happen to me. That would be the phrase that you would hear. It won't happen to me. Essentially saying like, yeah, other people, it might happen to someone else either because, they're just not as lucky as me or they're not as skilled as me or for XYZ, but, I'm never going to have an engine failure or I'm never going to, bounce a landing. It won't happen to me. That would be the hazardous attitude. And then the antidote for that would be
it can happen to you. Pretty straightforward. And then lastly, macho. Macho would be, I can do it. Basically doing something stupid or reckless just because you either want to seem cool or you want to impress someone. Whatever the reason may be, you are doing a unsafe and a dumb action. The antidote for this would be taking chances is foolish, which is very true. A lot of things in aviation, especially the cool things, are very high risk and very low reward. There's just no reason to do dumb things. There's no reason to take chances when chances don't need to be taken. So don't fall into that trap. One thing that I like to highlight here is, yes, these attitudes can be spoken, they can be verbalized, and you should try your best to recognize those. But a lot of times, these attitudes are going to be pretty deeply instilled in people. If someone has an anti-authority attitude, typically they're going to have that attitude towards everything in their life. It's not just going to be whenever they go fly. It's going to be present in their everyday. It's going to be really deep in their personality. So I would say a lot more often than not, rather than these being verbalized, you're going to see these things in people's actions. So if you have someone, if you have a student or you have an instructor, like I have had, someone who is constantly taking chances and doing dumb things, even if they don't, like, they're not going to be like, you know, I'm going to do this this dumb maneuver because I can do it and I'm better and you know I know that I can do it. They're not going to say that. They're just going to do it. But it's up to you to recognize the action behind the attitude, because a lot of times it's not going to be verbalized. And that goes for all of these. If you see someone who's constantly breaking the rules, who has no respect for, you know, the chief flight instructor and the rules that they've set out, then they have one of a hazardous attitude of anti-authority, and it should be addressed. But that's enough on that. Lastly, I'll just touch on, I'm not even going to write it down, personal minimums. Everyone should have personal minimums. I have mine in here somewhere, but having personal minimums is really important because it sets that boundary, and it's even more important that you actually abide by them. A lot of times when people think of personal minimums, they think of ceiling and visibility. Say, okay, my personal minimums are, if I'm a private pilot, I don't know, 6,000 foot ceilings and 5 section miles. Well, it's more than that. It's previous flight time, how proficient are you? It could even go as far as, you know, how many landings have you had in the past 90 days? How many flight hours have you had in this specific make and model in the past 90 days? Or even it could be 60 days or 30 days. It's up to you what you make it. But it's going to be more than ceiling and visibility. Wind is another big one too, crosswind. So just making sure you have that to help manage some of these human factor risks. And then I have a couple scenarios here that I'm going to run through real quick. On a climb out, a passenger begins breathing heavily and panicking. They state that they are a nervous flyer, and they say, "I've never been this far off the ground before," and they begin to feel dizzy. What are they experiencing? How do you correct it? How do you prevent it? And what are the risks associated? In this scenario, I'd say that the passenger is experiencing hyperventilation that has been exacerbated by the stress of flying for the first time and the anxiety of being in a small airplane really high off the ground. I came to that conclusion by the heavy breathing and panicking and the dizziness that they are feeling. You can't, it's really hard to prevent hyperventilation. You could, maybe ask them before the flight if they're scared of flying, or, if it's their first time flying, then you can maybe expect it. But it's really hard to prevent. Risk associated, there's really not a whole lot of risks. They could start to feel nauseous, maybe they throw up, which wouldn't be great. But like I said earlier, the worst thing that could happen is they pass out and their body auto-regulates their breathing, and then they wake up, a minute later. Alright, and then last thing I got is another scenario. You have been planning a flight with a close friend for months. It's their first time flying in a general aviation airplane, and the flight has already been canceled for IFR weather twice in the past 2 weeks. Today, the weather is right above your personal minimums, maybe a couple hundred feet above your ceilings, and your friend is very excited to go. You express the concern to him, and he says, it'll be fine, they're plenty high enough. What do you do in this situation? Well, you have to consider the motivation of the flight. So you really want to make the flight. It's your close friend that's already been delayed. However, do you kind of push the envelope, because it's technically inside your personal minimums? Do you go for it or do you not? Me personally, I don't think there's a wrong scenario or a wrong answer in this scenario. If it's in your minimums and you're comfortable with it, then you're good to go. But at the same time, you could say, it's really close. What happens if it deteriorates? I wouldn't feel comfortable going this close, even though I really want to. I would cancel the flight for another day. You could go with either one. I think either one would be correct, but it just kind of it shows, it outlines what you value and how your decision-making process is. For me personally, I would cancel the flight, and I would just go another day. Like I said earlier, you don't have to do anything quickly, and that's not just minutes, that's days. You have plenty of time to go fly with your friend 2 days from now. Unless, my friend has been in the hospital with a terrible disease and he's got 1 day left, then yeah, I'd probably make the flight, but that's not the scenario. So yeah, the best thing to do if it's anywhere close is just to call it off and try again another day. Alright, that's all I got for you. I'm gonna cut it off. We made it right to an hour and 30 minutes. That was human factors for CFI and private. Maybe it applies to commercial, I'm not sure. But yeah, that's all I got. Thanks.